Good afternoon, my name is Steven Ketelaars and I'm a bioinformatician in a group of Raymond Feyneman at the Netherlands Cancer Institute. I will be presenting the PROVENC study and work done primarily by Carmen Rubio in our group. In the PROVENC study, we try to assess the prognostic value of post-surgery ctDNA in stage 3 colon cancer patients. Patients diagnosed with stage 3 colon cancer are at a high risk of developing a recurrence. In the Netherlands, the current clinical guidelines for patients diagnosed with stage 3 colon cancer recommend adjuvant chemotherapy treatment after resection of the primary tumor. However, results from randomized clinical trials show that 55% of these patients would actually be cured by surgery alone and are hence overtreated, while 30% develop recurrences despite receiving adjuvant chemotherapy treatment. As such, only 15% of patients with stage 3 colon cancer actually benefit from adjuvant chemotherapy treatment. Therefore, there is an urgent unmet need to identify those stage 3 colon cancer patients that are truly at risk of recurrence after surgery and could benefit from adjuvant chemotherapy treatment. Here we use non-invasive circulating tumor DNA detection to identify which patients have minimal residual disease after surgery or after adjuvant chemotherapy treatment and are at high risk of recurrence. The PROVENC study is an observational study of the prospective Dutch colorectal cancer cohort. In this cohort, every patient diagnosed with colon cancer in the Netherlands can be included. The patients provide blood pre-surgery, post-surgery, post-adjuvant chemotherapy treatment, and every 6 months for up to 3 years. In total, 236 patients were included in PROVENC. The minimal residual disease ctDNA detection method is based on the whole genome sequencing analysis of the primary tumor, white blood cells and plasma after surgery. The method has a limit of detection of approximately 0.005% tumor content and shows a high reproducibility among different independent runs in our cohort. At the moment, we have results for 114 patients. I will not go into detail into the clinical pathological characteristics of the patients, but what is interesting is that the males were significantly more likely to be ctDNA positive compared to the females post-surgery. 30% of the patients experienced a recurrence, of which 41% were ctDNA positive post-surgery. Among the ctDNA positive patients post-surgery, 36% did not experience recurrence and were likely cured by chemotherapy. This Kaplan-Meier curve here shows that patients that are ctDNA positive post-surgery have a significantly higher risk of recurrence compared to ctDNA negative patients. Specifically, the hazard ratio was 4.52 with a confidence interval between 2.27 and 9.01. In addition, within the group of patients that experienced a recurrence, the median time to recurrence tended to be shorter for patients that were ctDNA positive post-surgery compared to ctDNA negative patients. The swimmer plot indicates the timeline from surgery to recurrence for each patient that had recurrence. To conclude, post-surgery ctDNA testing improves the stratification of stage 3 colon cancer patients for disease recurrence on top of current clinical pathological risk factors. These data enable the design of clinical practice-changing ctDNA guided interventional trials in stage 3 colon cancer to personalize adjuvant treatment decisions. Thank you.